Today, we're opening a conversation every woman deserves to hear. Pelvic health is central to our strength, stability, sexuality, and confidence. Yet most of us were never taught how to care for it. Kim Vopni, the Vagina Coach, is here to change that. Her work blends education and movement to help women prevent problems, recover after birth, navigate hormonal shifts, and reclaim trust in their bodies. This episode is about dissolving shame, understanding our inner foundations, and reconnecting to ourselves in a way that truly transforms how we feel from the inside out. Welcome, Kim. I'm so excited to have you here today to talk all things pelvic floor health.
Thank you so much for having me. I'm looking forward to the chat.
Great. So what sparked your passion for pelvic health? Where did it all begin?
Well, I always go back to when I was in sixth grade and I saw a childbirth video as part of our sexual health education, and that really scared me, planted a seed of fear, but it also planted a bit of a seed of fascination as well. And I remember coming home and looking at my mom and all the women in my life a little differently, saying, well, they did it and they're still walking around and they're okay. But I grew up thinking I was never going to have children. I started to see my mom, who had always been a runner, always been very active, very fit, stop running. She complained of back pain. She had a tummy that would never flatten no matter what she did. She had very heavy periods, and she ended up having incontinence surgery. She had a hysterectomy and struggled. And she would sort of, I would say, why does that happen to you, Mom? And she would jokingly say, it's because of your brother and you. And so it was sort of, again, painting that picture of pregnancy and childbirth are do a little bit of number on the body, which it does. But so again, it was just sort of confirming I don't want to have children. And then, of course, again, fast forward, I meet my now husband and wasn't totally sure if I wanted to start a family, but starting to think maybe I would. And then I thought, well, maybe I'll just have a cesarean section and then I'll be fine. And when my husband and I had the opportunity to witness my sister-in-law give birth. She allowed us to be in the room with her, and that was the first time I had seen any normal birth compared to, we see what's in the movies and that's it. And that was a very kind of, I will say it's the turning point that was really empowering for me. And the following year I was pregnant and now determined to have a different story than my mom. Took some inspiration from my sister-in-law. She used midwives, and when we signed up for midwives as well. And I remember asking them, what could I do to prevent tearing? What can I do to minimize the risks of incontinence? And they said perineal massage can be helpful. And we've heard of this thing called the Epino. The Epino is a biofeedback device that is inspired by women in Africa who use gourds of increasing size to prepare their pelvic floor for birth. And so obviously gourds wasn't necessarily going to become a mainstream product. So a physician who witnessed that worked with a team of people and created this medical device called an Epino. Epino stands for no episiotomy. Episiotomy is where they cut into the tissues of the perineum and the pelvic floor during a vaginal childbirth with good intention, create more space. But what we now know is that creates more significant injuries, and it's not standard of care anymore. It's more an emergency situation. But that was the inspiration for this product. It made sense to me, being in fitness, stretching and strengthening, which this device does, made sense to me. So I purchased one, I had a great experience. And then I thought, well, why doesn't everybody in the world know about this? And I'm in Canada. And I contacted the company and said, could I be a distributor here in Canada? And I didn't necessarily think that it would become a business. I thought I'll just have this little side hustle and help other women. So that's how it all started 21 years ago. And, again, I didn't start it thinking it would be a business. And now here we are again, 21 years later, and it has become my life's mission and business. And there's been many different sort of iterations along the way, but that was what the catalyst was. And initially I was working primarily with pregnant women and new moms, obviously with the intention of getting this information to women before a lot of the challenges happen. This is not going to guarantee that you don't have any pelvic floor issues, but with more knowledge, I think we can definitely prevent. And that was my kind of field for a while. And then I started to go through perimenopause and now post-menopause, and that said, this is really a whole life. This pelvic journey is part of all these life stages that we go through. And so there's been different iterations of what my business has looked like over the years, but that's how it all started.
And even everything that you just raised, you mentioned your mum sort of being bloated, having a tummy that didn't flatten, the episiotomy, and all these little things along the way contributing to our pelvic health, right?
Mm-hmm. Mm-hmm.
So it's all these little
1,000%. It's all
flags
connected.
that, oh, that's really interesting. So I too had an episiotomy with my first child. So it's good to understand this. So how did calling yourself the Vagina Coach shift the conversation or your mission?
When I initially started working in the more so in the prenatal postpartum field or yeah, field, I guess, I was a personal trainer and I took training to be a doula as well, not necessarily because I wanted to attend births as a doula, but I wanted the knowledge of being a doula, more knowledge of pregnancy, birth. So I was originally, my handle was the fitness doula. So I was kind of like a personal trainer for your pelvic floor, and birth preparation, postpartum recovery was my main focus. And then when I started to shift into, again, this perimenopause, post-menopause phase of life, much of the same principles were discussed. It wasn't necessarily birth preparation. It wasn't necessarily early postpartum recovery anymore, but the principles were still there. So what I was doing was very similar, but fitness doula as a name didn't necessarily resonate with some people who'd never been pregnant before. And so I knew I needed some sort of a shift, and I wanted it to be a bit more all-encompassing through all the life stages. And I think it was 2016. I have to look back, 2016, 2017, somewhere in there. I was speaking at a conference, and this conference was all women entrepreneurs. It was called the Mompreneur Conference. It was about 350 women in Toronto. It was the annual conference. All the speakers were some sort of a business coach, and I had been selected to present on a topic, and the title was How Optimizing Your Pelvic Floor Can Make You a Better Mompreneur. So when I came up on stage to do my talk, I joked that now you have a vagina coach, because again, all of the other people were some sort of a business coach. So now you have a vagina coach for your business. And it was a joke. But as soon as it happened, I was like, that's it. That's what I got to do. And it was a bit risky using the word vagina, especially on social media. And anyway, I just was like, that's it. People are going to remember this. It's catchy. I want to jump into this space where people whisper the word vagina.
I
Or
know. It's so good to say it out loud, isn't
Yeah.
it? Without
Yeah.
sort of thinking of offending, because that's what it is.
Yeah.
We don't
Yeah.
want to say that area or the pelvic area, or we're always
Yes.
sort of trying to minimize what it is.
Yes.
But that's the name of it. So
Yeah.
why do we have this shame attached
Yeah.
to it of
Just like we
saying the
can
word?
identify all the other body parts like elbow,
Yes.
shoulder. It's a vagina. It's a vulva. We need to
Yeah.
name our anatomy for so many reasons. So that's where that started.
So talk to me, why do you believe pelvic health is the foundation for every woman, no matter what age?
The more, again, through the various life stages that we go through, the more I see how vital it is to our quality of life, to our health span, to our longevity. And it literally is the foundation of our core, our center. And it's where our core, our pelvic floor is where we derive our creativity. It's our base. It's our sense of being rooted, grounded. It's how we literally transfer load through the body. And it's a part of the body where, we don't receive education other than naming maybe a little bit of anatomy when we are learning about sexual health or our bodies, but maybe menstrual cycle. That's kind of as far as it goes, how babies are made. Back to that 6th grade class with the childbirth video. We don't really get an understanding that it's a group of muscles, that we can train it, that being women, we go through various stages in life that increase our risk of this center or this root potentially not working as well as it could or should. But there's things that we can do about that. So we're not told this information at any age. Yes. So we're not given this information. And once you reach a certain phase of life, you might now start to, maybe you're experiencing symptoms, or even if you're not, you might start seeing messages maybe on media that light bladder leakage, you'll start to hear this terminology, or maybe you've heard it through mothers, aunts, grandmothers that I can't jump on trampolines anymore. Or, there's like common messages we might hear that makes us think that this is an inevitable part of life.
And then women go on avoiding certain things because of that.
Yes.
So then their quality of life
46% of women stop exercising because of their pelvic floor. And the majority of people in that study were, I would say, on the younger side. So it was wasn't the 60, 70-year-olds, it was the 30, 40-year-olds. And when you think about how important it is to exercise for so many reasons, and especially things that we are at greater risk for, especially post-menopause, like our bone health, like our heart health, like diabetes, cardiovascular disease. We remove one of the most important aspects of mitigating those increased risks. And now we just sort of further compound or increase those risks even further. So the pelvic floor is something we've received no education. I'd never even heard the term pelvic floor. And so then
I
when
guess
we are,
you start hearing about it when you fall pregnant. That's, I
a
think,
lot of people do, or they hear Kegels, they might
that's
have heard
right.
Kegel
Well, it's
exercises.
Kegels after, and then you kind of go, what is a Kegel? Am I actually even
Exactly.
doing a Kegel correctly? It's like, oh, you're just sort of
Exactly.
going in and out, in and out, in and out. You're not
Yeah.
actually taught correctly how to do it.
Exactly. Again, another missed
Mm.
opportunity. We don't get the education, or then if we do,
Mm.
it's like, go home and do your Kegels. Well, maybe they've just said the word, or they've given us a pamphlet, or we've Googled it and they say, oh, it's the muscles that you need to stop the flow of urine. We know from studies that Kegels are very effective when they're done correctly and consistently, but we also know that the majority of women do them incorrectly, again, because nobody is taught. So there's not a seed planted about why it is so important. And once people understand the anatomy, once they understand the jobs of the pelvic floor, once they understand the common signs and symptoms that things aren't working, and when you think of it through the lens of fitness and lifestyle rather than surgery and medication and pads, it changes the whole thing, and it brings this level of hope as opposed to this, okay, I guess I'm experiencing it now, and this is just the way it's going to be for the rest of my life, and I have to suffer through it or put up with it. So I really want to change the messaging, one, so people have the information. Knowing it ahead of time doesn't 100% guarantee you're not going to experience any symptoms. But when you have the information, when you have the tools, and you have access and knowledge about the professionals that can also help you as well, there's so much we can do preventatively, curatively, intervening earlier. But I also want people to know, even if you're hearing this and you're 70,
You
75,
can
80,
still
I've
make
had a
a change.
93-year-old in my program that make change. And I just think that's
Yes,
the power of adaptation of
knowledge.
the human body, right?
Mm. And I think I listened to on one of your podcasts before about it. Is it in France that it's
Other parts of Europe as well. Yeah, it's just
yes,
common practice.
it's
That's,
a common practice straight
yep.
after they receive how many
All
therapy sessions?
postpartum women receive, the latest that I've heard is anywhere between 6 to 12 sessions with a pelvic floor physiotherapist that is subsidized by the government. And this service is also available to women who have never been pregnant, but it is an automatic prescription or referral if somebody has been pregnant. Somebody who hasn't been can still ask for that, and it is still covered or subsidized by the government. So it just sort of, it's part of the culture. Like, it plants a seed that this is part of this process of child rearing, of pregnancy, of birth. This is how we can help optimize your body so that you want to get pregnant again, so that you have a happy, fulfilling sexual health lifestyle going forward, and also so that you can do all the things that you want to do without suffering, without limiting your movement because of some symptoms.
And feeling back in control and
Hmm.
being empowered by your body
And
rather than being
confident. Yep.
limited.
1000%.
So, what would you say the biggest myths are, Kim, when it comes to pelvic health?
The myths that I hear a lot are that it's normal. That's just part of aging. It's just
Hmm.
part of being a woman. That's what happens after you have babies. That's part of menopause. That's a huge one. Another myth is that if you have a challenge, you need surgery to fix it. Another one is, if you have surgery to fix it, then you don't need to do pelvic floor exercise afterwards because we've fixed the problem. Those are three big ones that I jump on my soapbox for.
And rightly so. I
Hmm.
mean, it's like when we're training our bodies in the gym, it's the same, it's still a muscle, isn't it?
Right.
And like you said, that is the base of
The
our whole
foundation of the core.
system. So if that is not strengthened. So talk to me about Kegels. Does it work for all women? Are most women doing it right? What is the difference between doing good Kegels and bad Kegels?
So a Kegel exercise is a voluntary, like, contract, lift, and let go of the pelvic floor. So it's a range of motion. It's sort of an engagement and a relaxation that the pelvic floor muscles go through. Just like with a bicep curl, the muscles contract when we lift the hand towards the shoulder and relax or lengthen as we lower the arm back down. We look at all the other muscles in the body. We have type 1 and type 2 muscle fibers. Pelvic floor has the same. It's a group of muscles. It's not one muscle. It benefits from movement for good blood flow, for circulation, for strength, for endurance, for suppleness. So all the things we do in fitness class, yoga, Pilates, resistance training. We can apply those principles to the pelvic floor, but we don't. If we do anything at all, we might think of Kegels or have been told to do Kegels, and they're sort of an elusive exercise because, again, very rarely is anybody ever taught how to do them or evaluated if they're doing them correctly. And as I said earlier, we know from research that the majority of people are doing them incorrectly. People think of a Kegel as a squeeze, and so their interpretation of that could be squeezing the inner thighs or squeezing their butt cheeks. Some people even hold their breath and bear down, thinking that they're generating force and that that's an engaged core, when that's actually oftentimes creating pressure downwards and could potentially be doing the opposite of what we want. So a Kegel was named after Dr. Kegel, and he saw women after childbirth, that was his population that he worked with, having pelvic floor challenges. He saw that they were having a more challenging time with the contract and relax. So he used what was called a perineometer, which is a biofeedback device that allowed women to be able to see when they contracted. And so similar to that Epino that I used, that was a biofeedback device as well. And that helped people see this group of muscles that they may, because we can't see our pelvic floor, it's on the inside. We can't go to the mirror and flex it like we do other muscles. And so it allowed them to see and connect with what they needed to do to activate and relax that group of muscles. And so a Kegel practice out of that was established, and sort of the gold standard in literature was you're going to do 3 sets of 10-second holds 3 times a day. That's what's kind of the gold standard Kegel practice. I don't know about you, but I don't know many people who are going to take 3 separate times in a day to do exercise, especially really boring exercise. And if they're doing it
and I
incorrectly.
wouldn't imagine you'd be progressing doing the same thing
Exactly.
every single day, right?
Exactly.
It's like strength training. You need to sort of shake things up in order to get change.
Right. So the limiting factor there, and where my bias always was and still is we need to apply fitness principles to the pelvic floor. Yes, we need some maybe initial kind of, again, I don't want to use the word isolated, but really focused on coordinating the breath with the pelvic floor so that we get that connection. Then
So
we
is
need
it
to layer
breathing in when you're sort of sucking up? Is the breath going in at the same time?
And this is a big stumbling point for people. When, like physiologically in the body, when you take a breath in, the ribs expand. So ideally, we take a breath in, the ribs are expanding. The diaphragm is moving from its sort of concave shape downwards, like in flattens. That's drawing air into the body. In order for us to get the most air in, what we need to happen below is we need the belly to expand and relax, and we need the pelvic floor to expand and relax. And then when we exhale, the pelvic floor contracts and lifts, the belly naturally draws inwards, the diaphragm is moving back up to its kind of concave shape, and the ribs are settling back inwards. So inhales are all about expansion and creating space and drawing air, allowing air to come in. Exhales are all about expelling the stale air.
Well, I've clearly been doing it wrong all these years.
See, most people are. You think you have to suck up.
So breath is a really important component when it comes to Kegels. And that's never been on the radar for most women. And so when we think in terms of exercise before I'm going in to do either a Pilates class or a weights class, is that something we need to be aware of when we're lifting heavy weights?
Yes. Yeah. So that kind of moving away from that static Kegel exercise that does not train the pelvic floor dynamically. It's one, like if you were doing 3 sets of 10, let's say somebody was doing 3 sets of 10-second holds 3 times a day. They had perfect form. They'd been evaluated for doing it correctly. There's going to be some benefit. I don't want to say that there's no benefit there. However, we are upright beings. We move, we lift, we push, we cough, we sneeze, we laugh. And all of that is pressure that the pelvic floor needs to manage. And if we are forever sitting in a chair or lying down on our floor or stopping at a red light doing our Kegel practice, it's not training it as robustly as we could. We need a dynamic element to the Kegel training. So we first connect that breath. I call it the core breath. Instead of Kegels, I use the term core breath. Inhale, expand, exhale, and engage. We practice and pattern that because many people are like, I've been breathing opposite. I've been doing it the opposite way. doesn't mean that you're not breathing. Of course, you're breathing, you're here, you're alive. But from an optimizing physiological, like normal physiologic function, we want to harness that relationship. We practice it, then we start to layer it into something like a squat or a bridge or a lunge or a bicep curl or a push-up or squat jump even. That would be a progression. But as you said, if somebody's going to yoga or Pilates or whatever exercise they like to do, when they understand the fundamentals, when they have worked on that connection with the core, they can bring that pelvic floor activation and relaxation, that core breath into their workouts so that they're kind of killing two birds with one stone.
And it's really creating that awareness, isn't it?
Mm-hmm.
I think once you lock in and practice that breath and create that awareness and have that intention before you exercise, then that gets the ball rolling to be more vigilant.
Yeah, bringing it into your exercise, especially if you are using resistance, and resistance could be your body weight or lifting weights or using bands. It could be power, so using more explosive movement. It could be increasing the sets, the reps. There's lots of ways to make it harder. That's a form of progression. And many people, especially people who have been into fitness, when they start really intentionally and consciously bringing the pelvic floor into their exercise, they notice that they lift heavier. They can last longer. They're not injured as often. So their performance in their workouts changes.
And you mentioned earlier on in the beginning about bloating. Often women might dismiss bloating as food-related or hormonal-related, but can it be pelvic floor as well?
So bloating sometimes it can be bloating, which often has a dietary hormonal piece to it. There's also the people they might say, I feel bloated, but maybe they do have more adipose tissue, more visceral fat. Also, if we think of another element of the core, the abdominal wall, especially all of the abs, the deep layer, the corset muscle called the transversus is the deepest layer. We then have the external obliques, and the external layer is the six-pack muscles or the rectus abdominis. The band of connective tissue in the midline between the two straps of the rectus is called the linea alba. And some people, if they've been pregnant before, might have noticed that they had a brown line on their tummy. It's called the linea nigra. That's a hormonal influence to that connective tissue. And when we are pregnant, and because of other things that can influence the abdominal wall as well, there's sometimes a move away from the midline of those two rectus muscles, and the term is diastasis recti. So sometimes what people think is bloating, or they think they've put on some weight, is sometimes the abdomen looking more protruded because there's less tone and that connective tissue has weakened. The abdominal muscles may themselves be further apart from the midline than they were before. So it might give the impression of bloating. Or people, if they are prone to being bloated, will notice they get a lot more bloated because there's less tone in the abdominal wall.
And so then doing the correct breath work, Kegel exercises could help with that.
Yeah, it's part of the posture side. So I always kind of look at it as ABC. Alignment, posture and alignment are what is going to optimize the breath, the core breath. And then once we have those two pieces, then we can start to coordinate it into movement. And that abdominal wall tension, that connective tissue that loses some of its tension and it becomes weaker and thinner. The way we regain the tensile strength is via the pelvic floor. So when we optimally contract and lift the pelvic floor, when we do the core breath and the exhale is that engagement, it should, in an ideal functioning core, co-contract with the deep layer of abdominals, the transversus abdominis, to generate some tension in that midline. And then, of course, once you then start to layer it into other movements, that is, and the thoracolumbar fascia as well, especially that's influenced by a lot of glute work. Glutes and the pelvic floor go very well together. So it's all connected, and it's not one magic exercise. It's not one magic. It's not just Kegels. It's the whole system
method
working together.
Yeah. Everyone talks about sneezing and having bladder leakage, but can that also impact the other end, your bowels as well? Because that's all part of your pelvic floor. And so these same methods apply?
Yes. Yeah, it's a very common question I get. So the pelvic floor, it's a group of muscles, as I mentioned. It's not just one muscle. It's 3 different layers of muscle that attach from the pubic joint at the front to the tailbone at the back to the sits bones, the two ischial tuberosities that you might feel the bony points in your bum. And that's sort of like a diamond shape. So that group of muscles closes off the base of the pelvis, the opening, and those are the attachment points. And externally, we can see our urethra and our vagina and our anus, those three openings. So the pelvic floor is part of its job is to be responsible for managing those three openings. Urinary incontinence, there's different forms, but stress urinary incontinence, where you laugh, cough, sneeze, jump, you exert some sort of force. If the muscles are not responding at the right time, or if they aren't able to generate enough force and close those openings, that's where urine can leak out in stress urinary incontinence. But gas or stool could also be leaking out, in which case that would be considered anal incontinence. So the same principles, sometimes the same principles as to what contributes to that problem happening is the same. And then the principles of overcoming that problem are very much the same as well. Of course, there may be a little bit of nuance for some people, but generally speaking, we want to look at the alignment. We want to coordinate the breath. We want to layer that core breath into movement to build strength, to build endurance, to make sure there is suppleness, because sometimes those challenges are happening not because the muscles are lax and weak, but because they're tight and weak. And we have an interpretation that tight is strong and that we want a tight vagina. And so when, again, we think of Kegel exercises, people think of them as a squeeze. And if I squeeze more and if I squeeze harder, I'm not going to leak. I'm going to have a really strong pelvic floor. But oftentimes, especially people who are leaking, people who are experiencing urgency, I need to get to the bathroom right now, people who are leaking gas or stool, people who feel like they don't have as much support for their organs, those people are unconsciously guarding. Am I going to leak? Is there going to be a bathroom nearby? Are my organs going to fall out? So we have a lot of tension unknowingly. We don't necessarily know we're doing that. But that tension, while we think that's going to be a good thing and my pelvic floor is going to be so strong, tight muscles are weak muscles. Tight muscles are fatigued and overworked. They aren't able to react at the right time or generate enough force for all the jobs that we need it to do.
Yeah, it sounds like you need it all to be relaxed to then be able to tighten, to then relax.
Yeah, you need
giving
an
and letting
optimal
go.
amount of resting tone. We don't want it to be just like hanging out, completely
Yeah.
relaxed, but we
That
don't want
sounds
it to be super high tone
I
either.
know. But it sounds exhausting to be holding on so tight all the time as well.
It is. And it's often
Yeah.
what contributes to pain. So you mentioned, we were talking about back pain earlier with my mom. 95% of women with low back pain have some form of pelvic floor dysfunction. And oftentimes it is tightness. It's all the muscles coming in to try to save the day. And it's oftentimes we need to let those muscles go so that they aren't overworking, so that they aren't restricting blood flow, so that they aren't hanging on so tight and creating restriction in our movement that then ultimately
And even just having that conversation, I realize that I'm holding on tight right now. And
a lot
then
of
just
people are.
being able to feel the difference when you let go. So it is super just to create that awareness in our bodies. So I want you to talk to me about the buff muff method. And I just love these names that you come up with. It's fabulous. No one will forget that name. What is it about the buff muff method that makes it different to other exercises?
Really, as I've sort of been weaving in the conversation, it's the element of let's train the pelvic floor like it's a group of muscles that, that we train like the rest of our body. Let's apply fitness principles to the pelvic floor and not just think we have to do these isometric squeeze exercises. We need to layer this into other things, and we need to understand that it's the foundation of the core. Once people understand that, so many people want a strong core. I want core exercise. I'm going to go to the core ab class. Well, if the pelvic floor is not part of it, then it's not really a comprehensive core class. So anyway, that's my bias. And I waited a while for there to be research to support my bias. So we've had oodles of research over the years about Kegel exercises. And we know that when done correctly and consistently, they can help. But I always said, I think we're still missing a bit of an element. We need to progress even more. We need to layer this into movement. And now, thankfully, we have some research that there's two pieces that I often refer to. One that looked at, and this was also elderly women with urinary incontinence, and they looked at a Kegel practice, so standard Kegels, done ahead of or before a resistance training program. And that the people in that when compared to just Kegels alone, fared better. Then there was one that combined the two together with a very similar result. And another one that looked like another kind of bias based on evidence of mine is, especially post-menopause, the benefits of vaginal estrogen. Vaginal estrogen, when combined with pelvic floor muscle training, when compared to pelvic floor muscle training alone or Kegels alone, fares better. People with vulvovaginal atrophy, which is sort of that genitourinary syndrome of menopause, where we have a whole host of signs and symptoms that influence our vulvas and our vaginas and our bladder health. When we combine pelvic floor muscle training with vaginal, in this case it was vaginal estriol as the form of estrogen, people fared much better and had results quicker. So those 3 studies took a long time to come to the forefront, but they're finally here and sort of supporting my bias in the Buff Muff method, which is I take a whole body holistic approach. I apply fitness principles of strength and endurance, release and stretch to the pelvic floor. And we also have to talk about the lifestyle factors in there as well, because I can give you all the, quote unquote magic exercises, but if you're straining to poop every day, if you're not drinking enough water, if you're consuming bladder irritants, if you're low estrogen, all of those things are going to play a role as well.
Like you said, there's so many moving parts, right? Everything has to be combined. But I feel like every woman needs to know this from a young age.
Yes,
even
we need
trainers,
to teach this in school.
Pilates classes you go to, instructors, people need to be aware where women are at different stages of their life and helping to remind us to connect with the pelvic floor before we go in and do a heavy workout.
I've been in fitness for actually, as of this year, 30 years. So 30 years and multiple fitness instructor, personal trainer, like multiple certifications along the way. Never was the pelvic floor ever talked about.
I know. And there's this Pilates class I remember going to, and they had everyone wide over the reformer and then wanting them to do wide jumps in the air, like extremely wide. I've had 3 children. I remember just going, no, thank you. I'm just going to do something else instead. I mean, bless her, she didn't know. She was probably about 22. But things like that can just do damage to women who are not connected and don't understand their bodies.
Yeah. And this it's a group of muscles. We learn about all the other muscles and the origin and insertion and the function. And we're missing this incredibly important part, especially in women. Men have a pelvic floor as well. So in 2013, I was in a business with 2 other women and we created a professional training course for Pilates, yoga, personal trainers, fitness instructors, because it's simply not taught in fitness and it has to be. It really has to be. So we created a course to educate. This is you as a trainer, you as a movement professional, you need to know this in order to be creating effective programs, safe, effective workouts for your clients and your class participants.
Because otherwise damage can be done. Like you said, you get the lower back issue. So if you've got a lax pelvic floor and then you're doing some deadlifts with some very heavy weights, then there's going to be potential to do your back in.
Yeah. And there's a lot of people who are leaking in their exercise. And again, they just they think it's normal and they just put their pad on, or they create compensations, or they avoid certain movements and they just cope. They just kind of suffer and they're like, oh, that's just the way that it is. But again, when you have that knowledge, it totally changes things and it opens up so many more opportunities for strength, for power, for endurance, and for that aging we're talking about. We lose muscle mass as we age. We lose more of our type 2 muscle fibers, or type 2 muscle fibers are the quick reaction time muscle fibers in all of our body. We lose more of those post-menopause, which is a big reason why we also have incontinence. So trainers need to understand this foundational principle to be able to teach it within their programs, and also know how to progress people using the core breath in their movements so that they can train their, especially female clientele, to age powerfully, to help them with that chronic low back pain that they've been chasing the symptoms. They've seen chiropractor, massage therapist, acupuncture. The missing link is so often the pelvic floor. So people then become better trainers. Their clients are going to stick with them for life because they're helping them with the back pain. Finally, they're helping them exercise in ways that they are really, truly getting stronger, and they don't have to run partway through to go to the bathroom or be afraid that they're going to be leaking or what have you.
Sorry. I think that's a really important message, especially for the trainers and the coaches out there, just to also bring to light for all the women that it's okay to talk about pelvic health. It's okay for a male trainer to talk about pelvic health with their female client. And I just
1,000%.
think that's what gets in the way often
It
is
has to
that
be. We screen
conversation.
for all the other things. We're asking
Mhm.
questions about cardiovascular disease. We ask
Mhm.
about their health. Well, I consider pelvic health a vital sign. If you have clients that are not pooping well every day, if you have people who are in hormonal chaos, if you have especially postmenopausal women, you have to ask, do you leak when you lift? Do
Yeah.
you feel a sense of heaviness or pressure? Have you ever seen a pelvic floor physical therapist? And this is in our course. What we also help people do is normalize this conversation. It's part of the anatomy. It's what you're doing all day, every day. You're talking about muscles and body parts.
Mm.
We need to normalize this conversation. And oftentimes it's the trainers, when they have this knowledge, they're the first ones to ask and to bring this up. And when people say, you can help me with that,
Mm.
they're all of a sudden they think, oh my gosh, I just thought this was something that, I've asked my doctor, I've tried this and I had surgery, many of them may have had surgery at some point as well. But it to me it's shocking that it is not part of fitness education. It really, truly needs to be. So until then, I'll keep my course here so people can take it
This is
after they become
fantastic.
certified.
We're getting the word out here today. So why do you think so many women dismiss symptoms like leaking and heaviness and, we don't often talk about it? It is taboo. Like
Mhm.
why is it still like that in 2026?
It's less so, but it is still.
Mm.
It is still a part of the body that we feel maybe shame or embarrassment. We feel it's
Mm.
taboo. We know from research, from literature, that it's sometimes not even so much the person feels embarrassed for themselves to ask, but they're afraid of embarrassing their care provider.
Mm.
Or if they speak to a care provider, they're often dismissed. What did you expect after you have babies? Well, that's just a natural part of aging. Or,
Mm.
or they're offered pharmaceuticals or surgery. And, in the defense of doctors, that's their training. They are trained in pill for the L. They're trained in surgery. So they see, all right, this person's dealing with these symptoms. What drug or what surgery do we have over here? That's their training. And they're also working, at least in North America. I think Australia and New Zealand are very similar. The model is not a lot of time. You go in, you can talk about one
That's right.
challenge. You can't
Mm.
really go deep into looking at root causes. You're going to get a prescription or a referral to somebody else, and you're out within 7 to 10 minutes.
So the best port of call would be a physiotherapist
1,000%,
specializing in
in my
pelvic
opinion.
floor. That
Yep.
would be your first port of call.
That's always my number one
And you
recommendation.
don't need a referral. You can just
It
head
depends
to a
on, there are
mm.
many private pay. There are some
Mhm.
people who may not have the funds to do private pay, so they may need to rely on an insurance company. So you would need to
Mm.
speak to your insurance provider to see if it is covered and what's the protocol. Do you need a referral to have it covered? So we can't blanket statements say everybody that's true, but generally speaking, there are many private pay clinics
Mm.
around the world. And in my opinion, it's the most underused women's health resource that we have.
Mm.
It would change the world if we had this available to everybody.
And for the listener out there right now, Kim, that's suspecting that they do have some pelvic floor issues and they're sort of not quite sure what to do, we've given them some tools about going to see a physiotherapist specializing in that area. What about some simple exercises at home? What would
Hmm.
be 3, without giving it all away, that they could sort of start with to see results?
Hmm. Yeah, I'm happy to give it all away. So yes, go see a pelvic floor physiotherapist.
Mhm.
Some parts of the world call them physiotherapists, some call them physical therapists, but as long as they are pelvic floor trained and they are licensed to do internal evaluation and treatment, that's who you want to see. In my opinion, should always be your first line of defense. And you make it an annual checkup. Just like you see the dentist once or twice a year for your teeth, you see the pelvic floor physio once a year for a checkup because things change. Don't wait until you have a problem to go see them. So that's
Because
number
it
one.
changes. It
Yeah.
changes pre-pregnancy, post-pregnancy, perimenopause, menopause. We're forever changing. So
Falls,
that's
car
mm,
accidents, stress, posture changes, chronic
mm.
coughing. So many things influence the pelvic floor that we don't necessarily think about. So that would be number one. The next two top things on my list, hydration and constipation. If you are not drinking enough water, and many people who leak or reaching for your water bottle, many people who leak or who have urges they feel they can't control, they don't drink water. They think, well, if I don't drink, then I won't have to leak. I won't have to find a bathroom. And as a result, they become dehydrated. The urine becomes more concentrated, and that will actually make you feel like you need to go more often. So you think you're doing the right thing, but it's actually making things worse. So you have to be hydrated. Another reason for being hydrated is also to make sure you're pooping well. The reason you need to poop well, there's many reasons why. From a pelvic floor perspective, if we are not literally getting the shit out, we are then going to be recycling toxins and excess hormones in the body, for one. And if we are straining to get that poop out, it's damaging to the pelvic floor. And if we don't completely empty, the fullness in the rectum will influence, like it's all tightly wound in there. They're pretty close neighbors. So fullness in the rectum will make the bladder feel like it needs to go, like you have to go to the bathroom. So kind of back to what I said before, I could give you magic exercises, but if you're not drinking enough water, if you're not pooping well every day, those have to be addressed before exercises are really going to make much of a difference. You also need to remove bladder irritants. Common ones are caffeine, alcohol, artificial sweeteners, sugar for some, dairy, gluten, carbonated beverages, acidic food. I don't know if I said that. Some B vitamins, C vitamins, some medications even. So you really have to do a bladder diary, track what you're eating and you're drinking, monitor your symptoms. And when you remove, caffeine is such a big one. People are like, but I only have 1 cup a day. If you remove that 1 cup a day, it can be life-changing in your symptoms. Some people will rely on that for their pooping, but it's also then contributing to urinary challenges for them. So you kind of have to optimize the diet and the hydration, letting go of the bladder irritants. And that's a huge piece. The other one I would say that's kind of tied to that is waking at night to pee. So many people, especially as we get older, we start waking up. And this is very common in the perimenopause, post-menopause with hot flashes, stress, anxiety. We wake up, we often will have some sort of a sympathetic response. So maybe we're having a hot flash. Maybe we wake up and then we're grumpy that we woke up and we're mad or angry. That's going to be a sympathetic nervous response. We're going to think, oh my gosh, and now I'm not going to fall back asleep and I've got a big day tomorrow. Now we're getting a sympathetic nervous response. That's going to make you feel like you need to pee. And then you think, oh, well, I woke up because I have to pee. So I go to the bathroom and I empty. And then I go back and I finally fall back asleep. I have another hot flash. Damn it, I'm woken up again, get another sympathetic nervous response. It's my bladder again. And so we associate waking with peeing because we get that sympathetic nervous response. It makes us feel like we need to pee. We go pee. But all that's doing is training the bladder to signal you during the night when we really should be staying in bed. So another thing I recommend for people is after you've done your bladder diary, you're tracking how much water you're drinking, how much fiber you're eating, making sure you're pooping well. Then you want to, when you wake up or any other time during the day when it's, say, an inappropriate urge. So if it's during the day, if it's less than 2.5 to 4 hours. And at night, we shouldn't have to pee at all. We should be able to go through the entire night without peeing. So you taper off your liquid intake 2 to 3 hours before bed. You've been very hydrated through the day. You've taken out your bladder irritants. You sleep. And if you do wake up, which most people will wake up a few times, when you do wake up, even if you start to get that, I think it's my bladder, it really isn't. And so you're just going to talk to your bladder. You're going to stay in bed. You're going to point and flex your feet.
What does that do?
You're going to scrunch your toes. It interrupts the signaling. There's a nerve that runs through it's called the tibial nerve. It influences the bladder. So we're going to interrupt that signal, pointing and flexing the feet. Or if you're standing, calf raises, scrunching the toes, doing some pelvic floor muscle activation and relaxation, calming breaths. Inhale for, say, a count of 3 or 4. Exhale for a count of 6, 7, 8.
And it's taking your mind away from the thought of wanting to pee.
It's distraction and also that calming. Yes, exactly. And then you're not gonna get out of bed and you're not gonna go pee. And that can change literally in that very first night that you do it.
Because then you're sort of training the bladder, aren't you? That it's okay if it's a little bit full. You just don't need to keep emptying it until it's...
If we keep emptying before it's literally actually full, then the bladder will say, oh, you're full here. I should signal you now as opposed to here. So every time you pee just in case, every time you pee just before you leave the house, every time you pee just before a fitness class, every time you tell your kids, we're going on a road trip, go to the bathroom. But I don't have to go, Mom. Just go try. That's all training the bladder to signal at inappropriate times. We should be in control, not our bladder.
I love that. That's really good advice. I wanted to touch on pelvic health influencing sexual pleasure and confidence. So if our pelvic floor isn't working correctly, is that going to impact our sexual relationships?
1000%. So the jobs of the pelvic floor, the main roles of the pelvic floor are because of the attachment points at the base of the spine and on the pelvis, are pelvic and spinal control and stability. Those 3 openings we talked about, continence, so managing those openings and keeping us continent, organ support, bladder, uterus, rectum. It plays a role in supporting our internal organs. It also, we talked about the relationship of the diaphragm in the pelvic floor. That acts like a bit of a sump pump, so helping with circulation and moving things through the body. And then there's sexual response. So the pelvic floor, part of its job is playing, pun intended, an intimate role in our sexual response. And our capacity for insertion, for touch, for pleasure. If we have muscles that are tight, so we've talked about that's very common in many people. That can be because of the fear. It can be because of worry, anxiety. It could be from posture, could be from scar tissue, could be from muscle imbalance. There's many reasons why the pelvic floor muscles may have tension. Tight muscles restrict blood flow, restrict circulation. We need good blood flow circulation for healthy tissue, for sexual response, for lubrication, for orgasm. We also, if we have tight muscles, that could potentially create pain, that maybe now touch could be painful. It also may inhibit insertion. So if we have muscles that tighten at the thought of insertion or pain, if we have muscles that tighten, that are tight all the time, or if we have tightness that happens once something is inserted, all of those can then create discomfort or interfere with our capacity for pleasurable sensations. So it is 1000% linked to and very important in terms of optimizing our optimizing our sexual health to make sure our pelvic floor health is in check.
I love that. And you mentioned before about vaginal estrogen as well.
Mm-hmm.
So that obviously would help, as well as all the exercises. But
Yeah.
how do we talk to our partners about it as menopausal, perimenopausal women? Do you have issues like this with ladies that come in and don't know where to start?
Yeah, it's common. Just like, again, it's a lot of people feel shame. A lot of people feel embarrassed. A lot of people feel like they're the only ones because they see other people who, well, my friends seem to be having sex all the time and they're fine, or my friends seem to be going to exercise class. So a lot of people, they don't realize how common this is.
Yeah.
Upwards of 40% of women are dealing with incontinence. 50% of women who've given birth have some degree of prolapse. Pelvic pain, a number of different types of pelvic pain, very, very common, but we think it's just us.
And we do. And I think
yeah.
as women, we carry around that shame, don't
Yes.
we? It's like, oh,
Yep.
we're broken. Something
Yes.
we've done has contributed to this, or something I'm
Yes.
not doing. This is
Yes.
why that's happening. It's my fault.
Yes.
And so it just becomes this narrative, and sometimes it's easier just not to talk about it because it highlights the shame.
I've often said that pelvic floor physiotherapy can save marriages or save relationships because just like women are avoiding exercise, women will also start avoiding social outings. They will abstain from or shy away from intimate relationships from fear that it might hurt or it's not pleasurable anymore.
Or it's not what it used to be. It feels different
exactly.
now.
And
but there are things that we can do
yes,
to get it strong and healthy
1000%,
again.
1000%. Everything
So
we've
what
talked about.
What shifts for a woman when she finally understands her pelvic floor?
They understand it's not their fault. They understand they're not alone. They understand that there are so many things they can do. And sometimes when I present lists of, I gave a few here, when I start saying all the things we can do, sometimes I can ramble on and then all of a sudden it's like, oh my gosh, that's a really long to-do list, right? And we think, we already have a really long to-do list and now you've just given me more things. But I say, just rather than looking at it as a to-do list, this is an opportunity list. You don't have to do all of these things, but all of these things are options for you. All of these things are opportunities for you to try. Not saying every single one of them will work, but one of them might, and one of them could significantly change everything. And knowing that that list is there and that you don't have to just sit and wait for the symptoms to become so bad and then you get to go have surgery, that's very disempowering. And again, people then, they lose their quality of life while they are sitting and waiting for things to get so bad. We're given this impression that, oh, it's not bad enough. You haven't suffered enough. Go suffer a little bit more and I'll tell you when you're ready to have surgery. And if, yes, I want to keep surgery on the table, that can be an option, but that should never be the first line of defense. And it's not something you sit around and wait for. You have to take action first.
And surgery is for prolapse, essentially. isn't it?
Incontinence, prolapse,
Okay.
not so much pelvic pain, not so much urgency incontinence.
But they're the warning signs.
Prolapse and stress urinary incontinence, very common to have surgical interventions. And surgery can be great. I've had a pelvic surgery myself, but my message from surgery is before you have surgery, I want you to ensure that you have addressed all of your root causes, that you have seen a pelvic physio, that you're drinking enough water, you're not constipated, that you have your tissue supported potentially with estrogen, that you're consistent with whole body pelvic floor muscle training, you pay attention to your posture, you're sleeping well. Like put all of the fundamentals in place because that often will eliminate your need for surgery and improve your symptoms. If it doesn't, and you still need or choose surgery, that has been your prehab. We should all be prehabbing for any sort of surgical intervention. And then it's also going to be part of your rehab. And most importantly, everything that you've done is going to be even more important after you have had surgery. Avoiding constipation, staying hydrated, ensuring the muscles work properly. You see a pelvic floor PT to help manage that scar tissue that results from that surgery. So many people are given a message that, I'll fix that for you. Your surgery, now you don't have to do any pelvic floor muscle training anymore. And I agree 100%. You need it even more.
Because again, surgery, scar tissue, right? So there's
Change the
other
landscape.
challenges.
Yep.
But also, I guess, Kim, looking at it like what you can do rather than what you can't do, and I think as women, we do get overwhelmed with all the information that's thrown at us and all another thing to do on our to-do list. But rather than looking at it, what we can't do, let's look at it like what we can do.
Right.
There might be 2 exercises in there that you could incorporate daily, or then you could rotate them around. So
and if you're bringing it into your other fitness, it's not an extra thing on your list. Initially, when you're first learning, it's an extra, say, 10 minutes out of your day to learn. But once you've learned it, you're just bringing it into what you're already doing. And the more we do, the more we can do. The less we do, the less we can do. And I think that it's, I always used to say, I've always considered myself very low maintenance. I don't need a Coach handbag. I don't get my nails done. I'm pretty low key. But with my health, I'm very high maintenance. It's the most important thing in my life. It's the most important thing because I'm not interested in suffering. Yes, exactly. And so as much as I look at it and say, yeah, I'm a little bit high maintenance with my health, but it's also high maintenance to be sick. It's high maintenance to have disease states. It's high maintenance when you have to go and buy pads and look for bathrooms and be worried and stop socializing. And I would prefer to be a little bit more high maintenance and not be suffering than the latter.
Me too. And we're tending to our bodies. We're nourishing ourselves. We owe it to our bodies to
1,000%.
push out the next 50 years full of vitality and health.
Exactly.
So, Kim, I really like to finish each podcast with the same questions. So what are the ways that you reconnect with yourself each day?
I am an early bird. I'm always the first one up in the house. And that is my cherished, alone, quiet, soulful time. And sometimes I read. Sometimes I admittedly will scroll on the internet. Sometimes I'll go for a walk. Sometimes I sit out and just enjoy the birds chirping and the sun. It can depend on where I am and the time of year. But that is one way that I always would say, connect with myself. And then some sort of a walk with usually my girlfriends or my husband throughout the day is also conversation always happens on a walk. And I've had some of the most profound ideas for my business, decisions with my husband and I, from kids raising our parenting or raising our kids and life moments with that. So that is a huge opportunity for connection for me, is the morning and my walks.
I agree. Being in nature and being in that flow, fully present state. What season of life are you in right now?
I am an empty nester, post-menopause, and perimenopause was rough for me, as it is with many. And it's now a chapter where we have this, my husband and I, we have this freedom that kind of back to when we were first dating and when we first started living together. And the kids are off on having their own adventures and also creating adventures for us to go visit them where they are in the world. And so it's a really fun and really exciting time, and lots of change. It's been status quo for the last 20 years of we've been raising our kids to be adults, and now it's time for some change and some fun. And so it's an exciting phase.
It's so good to hear that. I had a guest on yesterday that has just become an empty nester, and just the grief that she shared. So it's lovely to hear you coming out the other side and reframing it
Yeah.
into a positive experience. I'm sure we'll all get there.
Yeah. I
Uh,
shed some tears when my kids left. The first one when he went to university 3 years ago. And then I realized, oh, he was home a month later for Thanksgiving. And then when my second son, he went to Spain. That one was a little harder. He was on the other side of the world and
mm,
time zones away, and saying goodbye to him at the airport was tough. But again, it's just he's living his best life, and they both are. And so
yeah.
I
And
can't.
that's all you could ask
Yeah,
for.
there's really nothing to grieve. It's really a time of pride and excitement and opportunity, and so
Yeah.
it's a
And
great
now you
phase.
can focus on your business fully.
Yes. Yeah.
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 And lastly, what does living from the inside out mean to you?
Oh, well, geez, I'm the vagina coach. So I always say think inside the box. So everything in my world is always very pelvic floor centric. That's our core, that's our center. And when that is working optimally, everything else is better because we don't have to think about it. So even though I'm saying plant the seed, we always have to think about it. But when we're not thinking about it because we're distracted or because we're worried or because we're anxious, it just means that we are now fully present with our work, with our loved ones, with our friends, with ourselves. We can do all
Mm.
the things that we want to do when that is in check.
Self reconnection is everything. Kim, thank you for sharing your wisdom and bringing so much clarity to a part of our health that is so often overlooked. This conversation is a reminder that reconnecting to ourselves begins with understanding our own bodies, gently, honestly, and without shame. Before we end, where can people find you? I think no one's going to forget the name.
That's one part of why I chose it. Thank you very much for having me. It was a really, really great conversation. My website is vaginacoach.com. All of my social media handles are at Vagina Coach, and buffmuff.com is this kind of a, you can find Buff Muff on Vagina Coach as well, but it's a separate little page to learn a little bit more about the exercise program I have for people. And I also have a book called Your Pelvic Floor that people can find in most major bookstores and on Amazon as well.
Fabulous. Thank you.
Thank you.